Hi, I'm Dr. Sreelatha, and today I will be talking about a commonly heard topic nowadays, which is pre-implantation genetic testing, which is commonly called as the PGT-A. Now, to understand PGT-A, it's important to understand normal conception. How do women get pregnant naturally? So, when the cycle starts, the ovary starts under the influence of the hormone, starts developing a single follicle within which is an egg. On ovulation, which is in the middle of the cycle, it can vary for women based on their conditions, but around the middle of the cycle, they ovulate and the egg is released into the tube. The sperms, which are deposited in the vaginal wall, are now having to swim through the cervical canal and reach the egg waiting in the fallopian tube. If the egg and the sperm decide to live happily ever after, then they fertilize and they start multiplying. Now, here the egg is a single cell and the sperm is a single cell. When they fertilize, they become a two-cell stage, which we start calling an embryo. Now, as they progress through the fallopian tube, they multiply from a two-cell stage to a four-cell stage, a eight-cell stage, and so on, so that by the time they have close to reaching the uterus, they have formed what we call as a blastocyst, which are more than 500 plus cells. Here the blastocyst now has separated itself into an outer layer which we call the trophectoderm, which goes on to become the placenta, and an inner cell mass which goes on to become a baby. This blastocyst now finds a comfortable space in the uterine cavity, embeds itself, and after 10 days, we get to know whether the woman is pregnant or no when she misses her period. What does PGTA do here? PGTA is an extension of the IVF program and is usually recommended for women with advanced maternal age, women who have had previous IVF failures, women who have had recurrent miscarriages, women who want to achieve pregnancy in a shorter time, and also with severe male factor fertility. Now, what do we do here? Here, we simulate what happens in the normal human body by trying to get the eggs to grow under the influence of hormonal injections, which start from the second day to the 10th to 12th day or the 12th day. Here, the aim is multifollicular growth, but also we aim for the follicles to reach sizes of 18 millimeter and above. Once that's done, under sedation in the operation theater, we go transvaginally most of the time and we collect the eggs. Once the eggs are collected in the embryology lab, they are actually inseminated with the sperms, either through an ICSI or the IVF. When we inject the sperm into the egg, it's called ICSI, and we let the egg and the sperm choose by themselves in the lab, we call it IVF. Now it's a single cell each, correct? So now they have to fertilize. So the next day after the egg collection, we have the embryo's journey which starts. Similarly, like in natural cases, it goes from a two-cell stage to a four-cell stage, eight-cell, and so on till it becomes a blastocyst. Now, here's when the intervention comes. As it reaches a blastocyst, what we do is we do a trophectoderm biopsy. That means from the outer layer of this embryo, we take two cells and we send for chromosomal testing or genetic testing as we commonly call it, but it's actually chromosomal testing. All of us are made up of 23XX or 23XY chromosomes. So the embryo is screened for chromosomal abnormalities. And in a few days, the results are announced. Here, if, for example, we have collected 10 eggs in a woman who is 34, and we would be aiming for at least 3 blastocysts, and of this, we might be hoping for at least 1 or 2 euploid. When I say euploid, that means normal embryos, which are suitable for transfer. Now, what are the advantages of the PGT-A? The first advantage is that you would know that the embryo is tested for chromosomal abnormalities, and there is a better chance of success in your IVF program with each transfer. Second, it gives you reassurance the embryo is actually chromosomally normal. Third, it shortens your pathway to a successful pregnancy. What are the disadvantages of a PGT-A? Personally, this is what I'd like to say, that not all embryos who have had PGT-A testing always would actually stick, because the embryos may not like to be intervened with. Second is not all euploid or PGT-A normal embryos give rise to a pregnancy. So it can give you this false sense of hope that, I've had a euploid embryo, so I'm definitely going to be pregnant. No, that's something that we cannot assure our women. So if you ask me in short what a PGT-A is, I'd say that PGT-A is an effective tool in an IVF treatment program, but it needs to be personalized according to the patient and the couple's desire.